Well, they are numbers that should concern parents. Doctors at the UW Health say 1 in every 250 children have high cholesterol that is hereditary.
And if it's untreated, it significantly raises the risk of a heart attack later in life. Our Dave DELOZIER is in the newsroom with more on what parents can do to deal with this. Dave?
Yeah, hey, Susan. You know, high cholesterol has for years been thought to be a problem for adults that adults had to deal with. But now we know it is something that affects children as well. 10 to 20% of children have abnormal cholesterol levels. It is such a concern that the American Family Children's Hospital created a specialized cholesterol clinic.
He plays hockey. He loves all sorts of sports, so he's always outside running around like crazy.
To see 8-year-old Avery Eastman, you'd never know, but a simple blood test showed a problem.
It was a surprise.
A surprise because of what the test showed.
His cholesterol's a little bit high, and I'm like, well, what is a little bit high? And she's like, 332, and I about fell off my chair, because I know it's not supposed to be about, over like 180 or so.
Their pediatrician recommended that Avery see Dr. Amy Peterson at the American Family Children's Hospital.
In the type of high cholesterol that I knew Avery had, I knew a parent has a 50% chance of passing that disease on to a child. And how are you doing?
Avery's dad, Rob, has high cholesterol too, which is why doctors suggested that they check Avery's sister, Sydney, as well.
And we looked, and she looked at her results, and she's like, oh boy, we need to get her in here too.
Sydney, Avery, and Rob have what is called familial hypercholesterolemia. Their high cholesterol is hereditary. For children, if it goes undiagnosed and untreated, the risk of a heart attack later in life increases significantly.
So if people have this type of high cholesterol and go without a diagnosis or appropriate treatment, about half of men and about 25% of women will have a heart attack by the age of 50. And we know that that increases their risk of an early heart attack or stroke by about 100-fold.
But if treated with safe medications like statins, patients like Avery, Sydney, and their dad can avoid bigger health problems.
Knowledge is power. There's effective treatment available, and we know that lowering a child's cholesterol can be done safely and effectively with medication.
Now, the cholesterol clinic at American Family Children's Hospital is a one-of-a-kind here in this state, and it's been in operation for 5 years. In that time, they've treated approximately 1,500 patients. The American Academy of Pediatrics recommends that all children be screened for cholesterol beginning between the ages of 9 and 11. And Mark and Susan, that screening can obviously solve a lot of problems for children as they get older in life.
You have to know the numbers.
Something you wouldn't think of with kids.
Yeah.
Very interesting.
300, wow. Yeah. All right, Dave, thank you.
Thank you, Dave.